The QI Plan, presented by Keela Daly. Describing different quality methods within healthcare, internal and external quality health improvement programs are different quality methods within healthcare facilities. Internal quality improvement programs originate from healthcare stakeholders such as patients, payers, and physicians. Some examples include safety programs, cost reduction initiatives, and quality improvement programs. Some external quality improvement programs are drivers of change in the healthcare that are primarily a result of federal and state regulations. External drivers and challenges can be divided into 4 categories: legislative and political, economic, social and demographic, and technological. Basic models of quality improvement in healthcare involve gathering and reviewing data to evaluate the performance of healthcare delivery systems against accepting quality standards. Quality measure is healthcare serves 5 purposes and can fall into 4 broad categories. These categories include structure, process, outcome, and patient experience. Structure measures assess the structure and characteristics of a healthcare setting. Process measures assess the services provided to patients. Outcome measures assess patient health resulting from treatment. Lastly, patient experience measures assessing quality based on patient feedback regarding their experience. The role and importance of patient satisfaction. Patient satisfaction is an important and commonly used indicator for measuring the quality in healthcare. Patient satisfaction affects clinical outcomes, patient retention, and medical malpractice. Claims affect the timely, efficient, and patient-centered delivery of quality care. Patient-reported outcome measures, while the structures and process of care can be measured by patient-reported experiences. The role and importance of patient experience. Capturing the patient experience of care from a point of view of a patient brings together both the recipients of care and the providers of care to determine how much improve based on their mutual experiences. There is a growing body of knowledge that demonstrates that improving the patient experience decreases stress, speeds recovery, and improves health outcome for patients. Patient survey utilized for quality improvement measures. Statistics involved with different quality methods in healthcare. Quality performance measures are designed and conducted by statistics. For example, proportions in percentages, ratios, means and medians, and counts are all great examples. Proportion and percentages are the most common quality measurement because they are the easiest to construct and to understand. The numerator represents the number of people out of the total number of people in the denominator who actually receive the test treatment or experience the adverse outcome. Ratios are used less frequently because the numerator may or may not be contained in the denominator. The denominator is a proxy for the population. Means and medians would be used in this situation when discussing wait times and phone hold times. Counts could sometimes present simple as counts of adverse outcomes. Finally, composite measures are the summary of roll-up measures, combine different measurements into a single one or in order to report. Composite measures are either psychometric or clinic metric. Applying quality improvement methods. Place a priority on encouraging communication, engagement, and participation for all of the stakeholders affected by the QI process. Start an implementation of improvements with a small-scale demonstrations. Keep in mind and remind others that QI is an iterative process. Preparing patient satisfaction surveys for results and data information to begin the QI plan and program. Types of measurements that will be used within the QI plan. Facility and convenience, staff, and overall satisfaction within the facility. Questions that would regard answers that involve the hours of operation, convenience of location, cleanliness, waiting time in reception areas, comfort while waiting. Staff questions would be focused on explaining procedures, questions and answers, friendly and helpful, knowledgeable and professional, modest respect, and following confidentiality, for example, HIPAA. Overall satisfaction with the facility will also be measures within the QI plan, overall impression of the visit, willingness to return, and likelihood to refer to others. Design of the survey. Patient satisfaction survey with charting rating. Very poor, fair, or very good. Question and answer format. There's an example below. Leaders of the QI Task Force. Quality improvement must start and end with leaders. Leadership groups such as the governing body, for example, the board of directors, the chief executive, the CEO, and other senior managers, the leaders of the licensed independent practitioners, physicians, and nurses, for example. Members of this QI task force will include perfectly selected hiring, credential, and retention nurses and physicians. Other administrative personnel will be part of the QI task force. The governing body, the chief executive, the licensed practitioner, all revolve around the patient. The yellow is the governing body, being in the core. The purple is the chief executive and senior managers, revolving around the governing body. The licensed practitioners revolving around both, and then patients, of course, revolving around all. Suggestions for implementing the results of the survey. Analyze data findings and work on areas that need improvement. Low percentage areas, focus on first. Implementing the QI team to keep up with patient surveys and tracking results. Remember the goal of the survey in QI. Improve the patient experience of care, number 1. Improve the health populations and reduce the per capita cost of healthcare.